Of women, taking the life of one woman every single minute. Did you know warning signs for women are different than men and are often misunderstood even by doctors? And fewer women than men survive their first heart attacks. Think about that. Fewer women than men survive their first heart attack. Joining me now to unpack some of this information is Dr. Shilpa Reddy with Pacific Medical Centers, and she specializes in women's heart health, preventative cardiology, and heart failure. Thank you for being here.
Thank you for having me on, Marni.
First, I want to talk about the symptoms for a woman and a heart attack. As I mentioned, they're different than a man. How so?
So I think when a lot of people think about a heart attack, they think of somebody clutching their chest, having that severe chest pain, feeling like an elephant is sitting on their chest. Women, however, can present with signs that are much more subtle and can be a little bit confusing. For example, some women may have some nausea, stomach discomfort, maybe a little bit of shortness of breath. They may feel some pain in their jaw or their neck, maybe some arm pain, and so they may not be thinking that that could be a heart-related symptom.
All of the things, or a lot of the things that you describe, are symptoms that we have when we just don't feel well, or maybe we're, exhausted, we've had a long day. So how do we know where the line is and go in and see someone?
So I think that can be very difficult to sort out, and sometimes it's even difficult as a physician to help sort that out. So I think if you are experiencing any new symptoms, especially symptoms that may be brought on by exertion, I think those are important things to bring to the attention of your doctor so that you can sort through them together.
I think it's concerning and maybe surprising for some people at home when we said in that fact sheet that symptoms are often misunderstood by women but by doctors. What are physicians like yourself and others doing to help recognize those symptoms better?
So I think it's important to take a good history when a patient comes in, not just focus on, oh, they're coming in with nausea. Really get into, what makes them feel nauseated? When did it start? Are there any other associated symptoms with that? Also keeping risk factors in mind when you are seeing a patient. If it's a patient of a certain age that has high blood pressure, diabetes, high cholesterol, it's always important to think about, well, could this be a heart-related symptom?
Yeah, and listen to your body, right? I mean, you know your body the best. If you don't get, an opinion from a doctor you like, should you get a second?
Definitely. If you feel like what the doctor is saying to you is not accurate, or that you feel like there's something more to this, then it's always important to go in, see somebody else if you continue to have those symptoms.
Okay, the other thing we said that we reported just a moment ago, fewer women than men survive their first heart attack. Why is that?
So I think a large part of that may have to do with the fact that women can present with such subtle symptoms that they may stay at home. They may not seek care right away when they have those symptoms. They may just chalk it up to a stomach bug if it's some nausea, or, oh, well, I've just been working really hard and I'm just feeling a little more tired than usual. So they may present much later in the disease process, and at that point there may have already been a lot of irreversible damage done to the heart that the heart's unable to recover from.
Oh, good to know. So 6% of women who die suddenly of coronary heart disease had no previous symptoms. First of all, what is coronary heart disease?
So coronary heart disease is buildup of blockages within the heart arteries, and that buildup is cholesterol that builds up on the lining of those arteries of the heart over time. Typically, people don't have significant symptoms from heart artery blockages until they get to be above 70%. At that point is when the heart starts to have limited blood flow, and so there's decreased oxygen and nutrients.
So what would be some of the symptoms for coronary heart disease?
So those symptoms can be, as those blockages slowly start to progress, people may notice that they're getting more fatigued than usual. They used to be able to, climb that flight of stairs without any problem. Now they're noticing that by the time they get to the top, they're a little more short of breath. They're a little more tired. They may start to notice some chest discomfort, maybe not that crushing substernal or, chest pain, but maybe something more just like a little ache in the chest that they're not sure. And when they stop and rest, it goes away.
Final question for you before I let you go. We have about 30 seconds. What is the takeaway for women this month when it comes to heart disease as we are trying to educate and raise awareness?
I think the important thing to remember is that it's the #1 leading cause of death amongst women. And so remembering to modify your risk factors, high blood pressure, high cholesterol, if you have diabetes, making sure those blood sugars are well controlled, and making sure that you're checking in with your doctor regularly and bringing up any new symptoms that you may be experiencing.
Dr. Shilpa Reddy, thank you for your information. It is important, it is life-saving, and it sounds like we're making great strides. We've got a lot of work still to do.
We do. Thank you so much, Marni.
Guys, back to you.
Well, Travis